Worldwide, 75 million people have been infected with the HIV virus. Today, almost 40 million people in the world are living with HIV. 36 million people have died.
By and large, folks have a general knowledge of what HIV is, but with that knowledge, it has not propelled a lot of community members that are engaging in risky behaviors, meaning risky sexual behaviors or substance abuse behaviors, to be tested for HIV, to know their status, and to seek care and treatment. That remains a big problem for us within the African American community, and I think in large measure also with the Latino community.
When I first found out that I had the virus, I was angry. And as a result of being angry, I did some really reckless stuff, not caring about my life or anybody else's for that matter.
There was one young child, elementary age, where the mother hadn't disclosed her status at the time, and the child didn't even know his status. Once he reached puberty, he had a girlfriend, she got pregnant. He passed the virus on to her because he didn't even know his status.
A lot of times I question God because if I had the information that I have today, I feel like my dad could have still been here. And I remember that everything that he touched that day, everything he ate from that day, drank from, they threw it away.
So they feel isolated. And if I can attach something to them biblically, it's almost as if how people treated lepers. A leper had to identify and scream aloud and let people know, I'm coming, and everybody had to depart, as if they were going to infect everyone else. And from a biblical standpoint, people treated the leper because they believed the leper was unclean.
I wanted to go on a killing spree, and I didn't care because somebody infected me.
My affiliation or relationship with HIV and AIDS is the devastation that it has had on my family. Not only is my daughter living with the virus, I've lost a brother, 2 aunts. I have a cousin that's infected, and a great niece that's infected, and some other relatives that are infected. So we have had our...
He was going to school to be a minister, so he would actually sometimes do the eulogy because the families didn't want to have anything to do with them.
My experience as a Black person is that it was shameful. You didn't want anyone to know. You didn't want to put shame on your family. And so even if you find out that you're HIV, it would be a hush hush. And for me, it's a lack of not knowing. It's a lack of educating and education. Well, I'm Jamaican. I have a different culture from Afro-Americans. And so it differs with culture. Like even going to Jamaica, HIV is there like it's no tomorrow, but no one talks about it. No one is addressing it. And so people are walking around killing each other off, And like you say, if you don't talk about it, you're just walking to the grave. And you're taking other people with you because it's the silence. It's the silence that is killing.
My mother and father passed when I was younger due to AIDS and complications. And growing up with HIV in the 90s, it was very difficult because people were very uninformed of transferring the disease.
This young man used to be in my program and he moved back to Alabama. And I didn't know it when I was talking to her, but she wasn't, she would cook, but she would put his food on paper plates and plastic forks.
and she wouldn't wash his clothes with hers. She would wash his clothes, but she would wash them separately.
One of my best friends, growing up in elementary school, we were really close, and she knew my status through school because my adoptive parents told my school about the situation, and she knew about it through school. And one day she asked the neighbor, because me and her son was close and we used to share sodas and stuff like that, eat off each other, just being kids. And she was just like, oh, is my son gonna catch it through them sharing soda? And I just went home and stayed home for like 2 weeks.
Back then, it was such a stigma associated with the disease, and for years in the Black community and the church community, it was sort of taboo to have that conversation because HIV is totally associated as a gay disease. Because many pastors have not come to this point yet where they're comfortable about talking about that on Sunday morning.
When I was growing up my whole entire life and keeping a secret all the way up until my mom's death, like my best friend at the time, when my mom passed away, and I told her, she was like, why didn't you tell me? I'm like, there's no way I could have told anybody.
Ignorance. It started off, and it was started off for many years in the community as a gay disease, that two men having sex, you'll get AIDS. And people were ignoring heterosexual sex. They were ignoring just unprotected sex in general. They were ignoring drug use, and they were ignoring needle exchange opportunities. And because of the ignorance and thinking that's the only way you can contract it, people put themselves in situations where they were contracting it by other means that they could have avoided because they were ignorant to the fact that you can get it many other ways. But also that's a double-edged sword. Sometimes people thinking you can get it in many ways that you can't, and it's caused a terrible backlash in the community of people not wanting to shake hands or embrace someone with HIV. And so that caused people not to disclose that they have it, and it just keeps it going. So not knowing how you can get it has caused it to spread, but in ignorance of how you can get it has caused a backlash and also caused it to spread.
The whole thing about numbers to me is a stigma in itself. When you start saying that the numbers of HIV African Americans affected, that's a stigma right there. Anytime I hear that number, for me, it's alarming. The statistics show, statistics, we're number one. How can I ever come from behind that stigma that we're number one? You want to be number one in something good, but who wants to be number one always in something that's bad or negative, or visioned as negative?
Because I think the phobias that persons have related to this disease can be overcome with education. The more they're enlightened about and have knowledge about the disease and also the impact that it's having on the community, I think we can begin to open it up more in the Black church community, because our community still is led and guided by the Black church. And so it's very, very important that we begin to move more in that direction.
I'm not trying to guide anybody's behavior, and I don't want the church to necessarily guide our behaviors, but I want the church to join with public health and make sure that we are educating all of our members, all of our citizens, all the members of the congregation with all the information we know in our science about the realities of behavior, so that when people make decisions about sexual engagement or substance use, they're doing it fully informed and fully aware of the benefits and the consequences, both positive and negative. And I think in that context, the church fulfills its mission because it took care of the body in one respect, and it keeps the person alive so they can deal with the soul and the spirit. And I think when the church fails to address both or all three parts of who we are as human beings, they fail to do their service.
So many emotions, this whole roller coaster, this whole kaleidoscope of feelings in dealing with this virus came to my doorstep in the form of one of my children. So she taught me how to get over anything that would have prevented me from having a relationship with anybody with a virus. So she taught me how to love beyond the normalcy, or is there such a thing as that? When you love somebody, you love somebody.
After I got over being, after I realized that I wasn't dying and that I could live with this disease, and I started educating myself, I realized how blessed I was to have a family that supported me. And I looked around at other people who didn't have that luxury.
Treatment is prevention. Someone who's HIV positive, take the medication, become virally suppressed, that's prevention. Because once you suppress the virus, it's virtually impossible for you to pass it to someone else.
And so we need to have conversations both in the church, in the synagogue, in the mosque, in the community about sexual engagement. We need to talk about the glories of it, but then we should also be pretty frank and upfront about also the challenges and the negative consequences that can occur in sexual engagement.
And so where I'm telling you what God says, I got to be able to meet you what Howard Thurman says, the ashtray level on where you are. And your ashtray level of where you are is important for me to meet. Because if I can't connect with you on your level of where you are, then you can't hear anything from me. Maslow hierarchy of needs, I got to meet you on the lowest level. Basic level of making sure that you have food, you have shelter. That's how you can see the love of God. When you can meet people on their ashtray level, that's when people can receive the God in you and be able to be empowered to realize that God does love me.
Then, fish. Go out and save people and bring them back to those lives and show them the kind of love that I think is necessary. Provide them the kind of education. But make sure you give the education without the condemnation in it. Give them the information that there is no stigma with it. So I think that is important. So education should go all the way around. How many kids are dealing with their parents are dealing with this? How many young kids? And these kids are going home and having to seeing family members taking the medication. So we cannot be judgmental.
So I said to myself, you know what? I'm gonna be a voice, especially for Black women. Those women who can't speak up for themselves, and so that's what I've been. You said that HIV is not an alone disease. And it isn't. It really isn't.
The knowledge, the uneducated about the disease causes many of the problem. If we could talk about this like we talk about blood pressure and some of the other issues that people face in life every day, then we would be able to get a better grasp on the disease. But since we don't talk about it, since it's a taboo, since it's something and people look down, how you look at people, I found that when I give people real support and don't treat them differently when they tell me that somebody have AIDS or they've been in contact with it, and I embrace them even more, that they're able to deal with it, and then they're able to share and help others from becoming infected.
So for people to say that I'm carrying out their legacy, it's an honor because I feel like they may have left and they couldn't continue the fight, but I'll continue doing it for them in a different aspect.
And starting back in 1998 when I got elected, I started meeting people and learning about different segments of society and things that affect them. And AIDS was one thing that I thought was only in one segment of society. But in being in public office and meeting with people, I found out how AIDS permeates a lot of societies, and especially in the Black community, how it's not just the gay disease, but it's a disease that has gotten around to everywhere, and we must deal with it and not ignore it or just think of it as one stereotyped disease. And so
any ounce of compassion, any inkling of respect for human, you want to go to their rescue. You want to help, you know. So you become, you have turned your inward love to an outward force. So yeah.
I believe in abstinence. I believe that parents should work with their children to have their children be abstinent until such a point in their lives when they can handle the consequences, both positive and negative, of sexual engagement. I do. And I think that we need to empower parents to have the appropriate conversations with their children about abstinence. But at that point in time, when a child or a young adult makes a decision about their desire to engage in sexual behavior, I want to make sure that every parent, every grandparent, every aunt and uncle, every sister and brother has the information to support that young person in making their transition from abstinence to sexual engagement. So we all have to be properly educated about sexual activity and substance abuse, so that we can fully inform and make aware young people about all of these consequences, and they can go into those situations prepared for the engagement.
I always, when I make a comment, I always say, we are in this fight together. It's not about me. It's not about that person or this person. It's all about us. We in this fight together. We gotta try and stop the stigma. We gotta work together. If we don't work together, what are we doing it for?
I want to thank you for allowing us to be a part of something that will eventually bring all of us together. And I am most appreciative for the opportunity to listen to the stories that are being told by people who would not normally come out and say anything about a situation so devastating. When I sat here and listened to the stories of people talking about their lives and how they have been affected because of their infection, you know, or those who are not infected that are affected, when you begin to hear their stories, you really begin to see humanity at its best, not at its worst. The worst part about it, the worst part of humanity is when you don't do something. But because of you and what you are allowing us to do, we're able to address this and at least attempt at trying to find a way to bring some understanding to a situation that could take us out.